Queensland, and good morning Harvey Bay. It's a beautiful day here, it's absolutely gorgeous, and we're joined with the local member Adrian, and of course the regional cabinet is meeting in Harvey Bay today. In fact, we're going to be meeting on the school grounds and have our cabinet meeting, and then cabinet ministers are out and about across the region over the next few days. So if I can just give a COVID update first. So we have 0 community cases, so that's excellent news, Queensland, well done. But we have 2 cases detected in hotel quarantine, and the Health Minister will update on that very shortly. And in the past 24 hours, we've had 8,500 tests, so that's really important, Queensland. If you have any symptoms, please go and get tested. And in good news, we had over the weekend 56,907 vaccines on our Super Pfizer weekend. So that is absolutely tremendous news. We're at 59.77% of first doses, but we get the federal vaccination numbers in, they're about 2 days behind. So we're pretty confident. We've clicked over that 60%, which is wonderful. And we have 41.47% of eligible Queenslanders fully vaccinated, which of course is really good news as well. However, we need to drive those vaccination rates up even higher. So can I stress to Queenslanders, please continue to get vaccinated. If you have not been vaccinated, now is the time. So make sure that you either ring your local GPs, go to one of our vaccination hubs, and of course we've got the Moderna coming into the pharmacies as well on the weekend. And now, if you think about it, having had that number of people vaccinated, 56,907, Adrian, I think it's about the size of Harvey Bay. So that's right. The equivalent of having the entire population of Harvey Bay vaccinated over the weekend. But we need even more. We have got a sense of urgency here, everyone. We have got to get people vaccinated because we don't want to see our hospitals overwhelmed and our people sick, and the consequences that can come with long COVID if we get a Delta outbreak here in Queensland. So we have to be absolutely super prepared. So that's my issue for Queenslanders. And what we're trying to do here in Queensland is protect our freedoms. In Victoria and New South Wales, they're trying to get their freedoms back. So you would have heard Victoria talking about having 30 people for Christmas dinner. We have 100 people allowed to come to your homes at the moment in Queensland. We are about protecting our lifestyle, protecting our freedoms, and that's why the vaccination is so important. And just before I hand over to the Health Minister, I just wanted to mention that we're very pleased to bring the Cabinet to Harvey Bay. We've got a great investment happening here in the local high school. We've got a brand new STEM building which is behind us here, which will be completed around October. We've got between 25 and 50 local people on site that are constructing that. And having met the school captains who have come in from their holidays, thank you very much for doing that. I know they know how important it is to have this infrastructure here for their local school, and plus the Performing Arts Complex that was opened by the Minister early this year. We've also had massive investment into the emergency department here at Harvey Bay. There's road upgrades happening, and of course this is a beautiful place of Queensland. It's school holidays, and I'm quite sure there's a lot of families out and about, like across Queensland. I understand the Gold Coast has got record numbers at the moment with people backing the industry there. I've heard from my staff it was difficult to get accommodation in Harvey Bay, so obviously it's a very popular tourist destination, and we're hearing that around the coast. So Queensland, let's get out and support Queenslanders as we know how to do that. So I'll hand over to the Health Minister, then Minister Grace and Adrian will say a few words, and then we're happy to take a few quick questions.
Thank you, Premier. So as reported, we have 2 new cases here in Queensland. One's overseas acquired and detected in hotel quarantine. The other one is domestic, acquired in New South Wales and in hotel quarantine. So identified that they were positive on day 1 in hotel quarantine and flew in from New South Wales on the 17th of September on QF 516 through the Brisbane domestic airport. He was fully vaccinated, and so we don't have a lot of concern in relation to this one, because any flights coming in from New South Wales are deemed red flights anyway. So people getting off those flights are deemed to potentially be infectious and generally going into hotel quarantine. So we're pretty confident that there's low risk in relation to that case. And of course the other one is overseas acquired in hotel quarantine. We do have one other case that isn't classed in our numbers or identified in our numbers today. This is a person who has tested positive in the Northern Territory, who has transited through Brisbane domestic airport. So they have flown from Newcastle to Brisbane on the 17th of September, spent about 4 hours at the domestic airport that day, and then travelled on to the Northern Territory and tested positive there. So we are just having a look. That person arrived on JQ 484 at 5:10 p.m. on the 17th. So we will potentially be putting up information about the length of time that that person was there and the gate that they left from. Again, the flight that they came in on was deemed a red flight anyway, but we're just wanting to make sure that that person, in the 4 hours that they were at the domestic airport, did not move around very far, and whether they went to any food courts or any other areas. So please, if you were at the Brisbane domestic airport on the 17th of September, just keep an eye on our website today to see if there is any exposure sites lifted. Now, as the Premier said, amazing results. Super weekend was just that. Everyone came out in huge numbers and got vaccinated. So 56,907 vaccinations over the weekend. This brought our total that Queensland Health administered in just 7 days to 178,808. This is over 32,500 more than a week ago. So well done to all of our health workers who came out and manned those vaccination hubs on the weekend, to all of our care army, to the SES, to the police who are all there helping manage lines. Thank you to the public for coming out in huge numbers and your patience, bringing water and hats and sunblocks. I even saw some brought their own chairs with them. So thank you, because of you, we are seeing a huge uptake in our vaccination numbers. But as the Premier said, we need more. Now, we don't know what our percentages are based on our weekend vaccination rates, because the Queensland's vaccination numbers are updated by the Commonwealth 2 days behind. So we'll know in the next couple of days exactly what that uptake meant. But what we do know is we would have ticked over the 60% mark of first vaccinations, and we were sitting on 41.47 fully vaccinated on the 18th. So with our weekend, the GPs, who we know were working hard on the weekend, and our community pharmacies, I know we've topped the 60%, so well done, Queensland. Keep coming out and getting tested, any symptoms whatsoever. I've already driven past a drive-through testing clinic this morning and saw cars lined up. So well done, Hervey Bay residents, for coming out and getting tested. It's really important that we keep getting tested and, of course, keep coming out and getting vaccinated, because that will ensure that we can protect the great lifestyle that we have here in Hervey Bay and right across Queensland.
Thank you. Grace? Thank you.
Thank you, Premier, and great to be here with local member Adrian Tantari and the Health Minister. And can I thank the students, the school leaders at Hervey Bay State High for coming out. It's the school holidays and they're all decked out in their uniforms and have made a special effort to come out this morning. And can I thank the principal and deputy principal as well for being here. This is a wonderful school, a growing school, 1,300 students, and we know that it continues to grow, and we've invested about $21 million in the school with a beautiful brand new performing arts complex of around $11 million investment, and we have a brand new STEM building and they're working on there now. We've got Ben and Tony here from Evans Built, and about up to 50 workers that we've had on this site right here locally in Hervey Bay, you know, as part of our economic recovery and providing great facilities in schools right throughout Queensland. It's great to be here as Education Minister. Hervey Bay State High has done a remarkable job. We see new buildings all around us, and I want to thank the school leaders once again. I think it's a big effort when they've got exams coming up after the school holidays, to take time out to be here. But it's wonderful to be here with the Premier, where we can have a look at our investment in this great school, but also have our cabinet meeting in the brand new $11 million Performing Arts Complex. It's a great honour to be Minister for Education, and it's fantastic to be here in Hervey Bay. And now the local member, Adrian Tantari. Thanks, Adrian.
Okay, what can I say? It's a great day for Hervey Bay, and I'm very, very proud to be the local member and welcome the Premier and her Cabinet to Hervey Bay. As Ministers and the Premier said, Hervey Bay's moving forward in leaps and bounds since the last election. Obviously, we've had a lot of investment in the area, and the Ministers are going to get that opportunity to go around Hervey Bay and see the investment that's being done here in Hervey Bay. As the Premier said, we've got the new Cultural Arts Centre here that's been developed and opened just recently. We've got the new STEM building that's being opened, over $5 million, as well as the mental health unit that's being built just over on the hill, $34 million, plus various other works that's going on. This is an example of what's happening when you have a local member in government, but also it also provides an opportunity for the local residents here, plus the community leaders, to actually meet the Cabinet and the Premier face to face and talk about the projects, the programs, our aspirations, hopes for the future, and really leads us in good stead in what we want to do here in Hervey Bay. And I'm really proud as local member to have the Cabinet here, and I really do thank the Premier for. We put out a request when the Premier first arrived just after the election. She said, I'll be back in Hervey Bay as soon as possible. But obviously COVID got in the way. But as soon as she could get here, she got here with her Cabinet. And I really thank you, Premier, for coming to Hervey Bay. And the residents are really looking forward to the opportunity to speak with you. And so are the community leaders and business leaders here to just speak about what's happening in Hervey Bay.
Thank you. I'm happy to answer a few quick questions before our Cabinet meeting.
Premier, do you have an age breakdown from the vaccinations that happened over the weekend?
Look, we'll get that out for you, but at the moment, because so many people got vaccinated, I'm just so proud of Queensland for coming out. And just some local figures I've got here as well, just about who came out here locally. Let me just grab those. We had, in the Wide Bay, we had 734 and Hervey Bay came out to get vaccinated, 959 in Bundaberg, 246 in Maryborough, and 116 people in Childers. So great to see Wide Bay coming out and getting vaccinated on the supervisor weekend.
And Premier, walk-ins were permitted across the state of vaccination hubs. Was that successful? Can we expect to see that?
It was so successful. We're going to have some meetings, but I'm pretty confident we are going to look at having them in the future as well. I think a lot of people were a bit disappointed that they couldn't get there. They may have had travel for school holidays, or they may have had work commitments. So we are looking at when we can hold the next supervisor weekend.
Why wasn't there enough enough doses for walk-ins at Logan and Capalaba, where people had to be turned away on Saturday?
Yeah, we addressed that yesterday, and it was just unprecedented demand. Like, no one could have foreseen the amount of people who were turning up there, but it was my understanding was it was rectified for Sunday.
What is Christmas likely to look like for those who are vaccinated and those who are unvaccinated, and will home quarantine be an option by that time?
Yeah, well, in Queensland, let me say this. We enjoy our Queensland lifestyle. My Cabinet is able to come to the regions because Queenslanders have done such a great job, but we know that that virus can come at any time, which is why we need those vaccination rates up as high as possible. So we want to see the vaccination rates at 80% and higher. So I'm urging Queenslanders to come and get vaccinated. In New South Wales and Victoria, families are in lockdown. They are trying to get their freedoms back. That is why they are vaccinating to get their freedoms. In Queensland, I need families to get vaccinated to protect our freedoms, to protect our lifestyle. So, you know, if we want to be able to continue to travel across Queensland and meet 100 people in our homes and everything, we need Queenslanders to get vaccinated to protect what we have and we hold so dear.
Premier, Queensland's faring the worst in terms of vaccination rates. Do you think these super-vax weekends are the key to putting us ahead of other states?
I think they're working really well because on weekends we know that people are busy during the week, and on weekends they can go and drop into their local centre to get vaccinated. But we also know Moderna's coming, so people have the opportunity to go to their local pharmacies. There's more GPs coming online. They'll be able to go to their GPs and get vaccinated closer to home. But I think it's, the Supervisor weekend showed us that Queenslanders were willing to come out in droves. We've also had pop-up clinics at some of our sporting events on the weekend, which helped as well. And just in relation, let me just address your issue about vaccination rates. New South Wales is going through a big outbreak. They were given more supply. Victoria has an outbreak. They were given more supply. We get the supply, we'll get it out into people's arms.
New South Wales and Victoria have released their roadmaps out of COVID. Obviously, their situation is very different to ours here. But
Completely
what does the
different
future
to
look
ours.
like for us, particularly when you reach that 70% double dose?
Well, at the moment, we're seeking to get those higher rates of vaccination to protect our lifestyle. So you're talking, if you look at their roadmaps are actually less than what we are enjoying in Queensland at the moment. So if you get vaccinated and we get high rates of vaccination in Queensland, we won't have to go backwards. So we want to go forwards.
When can Queensland expect a plan about when the borders will open?
Well, that depends nationally on when the whole of the country reaches a particular threshold, and the Doherty Institute is working on those issues for National Cabinet at the moment. My understanding is that National Cabinet will meet in a fortnight's time. Okay?
Yeah, a question as well about the Caboolture Hospital. Could you explain the terms of reference?
I might get the Health Minister to address that one. Is that all right? Thanks.
So the terms of reference have been set by the chair of the Metro North Hospital and Health Board. They've engaged an independent specialist from interstate to do this review. This is the proper course, I would expect, as our hospital and health services are all independent statutory bodies, to take this course of action. I've made it very clear, and the chair has put this in the terms of reference, that people can come forward with any concerns or complaints or issues that have arisen at the hospital, and they will be considered as part of this review. We have encouraged people to come forward, both with the phone lines that we've put out there and through the web address, to contact us if there are any concerns about past treatment at the hospital.
The Hervey Bay Hospital's been in a code yellow situation for a number of weeks now. What's being done to address a beds shortage there and also a doctor's shortage?
So I was just actually meeting with the Urine ambulance station and talking to them about the issue of the demand and ramping. I'm visiting the hospital after the cabinet meeting today to talk to the staff, to talk to the chief executive and the board chair. We are putting lots of investment in here, and the ambulance officers did say they've noticed some improvement because of us purchasing extra bed capacity. We're certainly, as Adrian said, investing in the hospital here, but I want to hear firsthand what they're doing locally. We've put over $267 million extra into the system in the last 6 months to create bed capacity where we are seeing those demands across Queensland. So I'm really keen and looking forward to meeting with the staff, meeting with the executive and the board today to hear what they're doing locally to ensure that we can improve those responses.
Will we be looking into the level 3 of the emergency department that's a vacant level at the moment?
So I'll be talking to them about all the initiatives they are taking already and what they're planning to take to deal with the pressures, because it's not just about emergency department. The reason people end up in ambulances and in our emergency departments is bed capacity in the hospital itself. So that's why we've invested in extra beds, both in the public and private sector, because if we can free up beds, it means people can move through emergency departments far quicker, and that's our objective.
If the borders reopen, are you confident that regional hospitals would be able to cope with the extra demand that could potentially happen?
We've been very fortunate because we've managed to contain the virus and stop a broad spread in our community in Queensland because of the decisions we've made. We've been planning with our hospitals right across Queensland from day one how to manage a big outbreak, and we are doing the work right now. How do we plan for the next stage and to manage COVID in our communities? I can tell you what I don't want to see. I had to wake up yesterday morning and read that New South Wales had just hit 55 people dying in 5 days. These deaths are being announced via Twitter now. You can imagine how those families feel. It is devastating. 55 people in 5 days. We've had 7 people sadly pass since the start of the pandemic over 18 months ago in Queensland. So we are very well placed. Every hospital I visit, small and large across Queensland, have adapted the way they are managing their hospitals and have spaces reserved. They have staff trained up. We have the PPE supply. I have absolute faith in our hospital system and our staff to manage COVID going forward.
Okay, all right, we have to go to cabinet, guys. We'll see you tomorrow. And this afternoon.